Welcome to Concussions in School, Return to Learn, adapted from Pitt County Schools' Return to Learn procedure and the U.S. Department of Health and Human Services Centers for Disease Control and Prevention's Heads Up for Schools. Pitt County Schools is committed to providing the best care possible for students who have experienced a head injury, whether it occurs on one of our campuses or at home. A part of that care is understanding what a concussion is, what symptoms a student might experience, and how we can support that student in the classroom. Pitt County Schools has implemented a return to learn procedure that outlines our response when a student has a head injury occur at school, or when we are notified that a student has suffered a head injury or concussion outside of school. We created this procedure in compliance with the North Carolina Board of Education policy, Return to Learn After Concussion. So what is a concussion? A concussion is a brain injury that changes the way the brain normally works. It's caused by a bump, blow, or jolt to the head. Concussions can also occur from a fall or a blow to the body that causes the head and brain to move rapidly back and forth. Even what seems to be a minor bump to the head can be serious. The potential for concussion is greatest during activities where collisions can occur, such as during PE class, playground time, or school-based sports activities. Proper recognition and response to a concussion can prevent further injury and help with recovery. The facts. All concussions are serious. Most concussions occur without loss of consciousness. Recognition and proper response to concussions when they first occur can help aid in recovery and prevent further injury or even death. Children and adolescents are among those at greatest risk for a concussion. The signs and symptoms of a concussion can show up right after an injury, or may not appear or be noticed for hours or days after an injury. This is why it is so important that we notify parents of any head injuries that occur at school. Be alert to the following signs and symptoms of a concussion after a head injury. If the student appears dazed or stunned, is confused about events, answers questions slowly, repeats questions, can't recall events prior to the hit, bump, or fall, can't recall events after the hit, bump, or fall, if they lose consciousness, even briefly, if they show behavior or personality changes, forget class schedules and assignments. Sometimes days after a concussion, a student may report some different symptoms. They may be emotional, irritable, sad, more emotional than usual, nervous. They may have physical symptoms such as headache or pressure in the head, nausea or vomiting, balance problems or dizziness, fatigue or feeling tired, blurry or double vision, sensitivity to light or noise, numbness or tingling, just not feeling right. They may report things like difficulty thinking clearly, difficulty concentrating or remembering, feeling more slowed down, sluggish, hazy, foggy, or groggy. They may report sleep problems, being more drowsy than usual, sleeping less or more than usual, or having trouble falling asleep. Concussion danger signs. If you see any of the following signs and symptoms in a student with a head injury, call for a first responder, the parent, and possibly 911. We need to be alert to symptoms that worsen over time. The student should be seen in the emergency department right away if he or she has one pupil larger than the other. That's that black part in the middle of the eye. You can see it demonstrated in the picture on the screen. Drowsiness or cannot be awakened. A headache that gets worse and won't go away. Weakness, numbness, or decreased coordination. Repeated vomiting or nausea. Slurred speech, convulsions, or seizures. Difficulty recognizing people or places. Increased confusion, restlessness, or agitation. Unusual behavior. Loss of consciousness, even if it's brief after a head injury. So if a student has a head injury at school, what we want you to do is call for a first responder, the school nurse or athletic trainer, for evaluation if a student has any kind of forceful bump, blow to the head or to the body that results in a rapid movement of the head, and any change in the student's behavior, thinking, or physical functioning, including nausea and vomiting, balance problems or dizziness, double or blurred vision, sensitivity to light or noise, headache, feeling sluggish, foggy, or groggy, concentration or memory problems, or confusion. A student who has experienced a bump, blow, or jolt to the head and experiences concussion symptoms should immediately be removed from active participation in PE, recess, or sporting activities, and not allowed to return to those activities on the same day. A head injury home treatment guide should be given to the parents for follow-up care. And always, if a student loses consciousness after a blow to the head, call 911, a first responder, and the parent. What to look for after a concussion. Increased problems paying attention or concentrating. Increased problems remembering or learning new information. Longer time needed to complete tasks or assignments. Increased difficulty organizing tasks. Inappropriate or impulsive behavior during class that's unusual for that student. Greater irritability. Less ability to cope with stress or more emotional. And of course, any of the concussion symptoms listed earlier in this presentation. As a school staff member, you might be the first to notice these types of concussion symptoms that show up maybe hours or days after the concussion. If you see these issues with a student who's had a concussion, notify your concussion contact or the school nurse. Returning to school after a concussion, students may need to limit activities. Exercising or activities that involve a lot of concentration may cause symptoms to get worse. Students may need rest breaks during the school day, to spend fewer hours at school, to be given more time to take tests or complete assignments. They may need to receive help with schoolwork and/or reduce time spent on the computer, reading, or writing. Your concussion contact, along with the school nurse, will help identify student needs and accommodations based on input from the physician, family, and the student where appropriate. Please be aware, students who continue to experience concussion symptoms after an injury should not be allowed to participate in sports or recreational activities, including PE, active recess, sports practices and games, and parents should be notified. If symptoms return during an activity, they should be removed from the activity, and this should be reported to the parent, school nurse, and concussion contact. An example would be the student who's returned to PE class and is running in the gym and tells you that their head is starting to hurt again, or they have blurry vision, and those are symptoms that are coming back. We need to remove that student from the activity and be sure that those caring for that student are aware. Preferably, they should delay returning to their activities until a healthcare professional experienced in evaluating for concussion says they're symptom-free and it's okay to return to play. It's normal for students to feel frustrated, sad, and even angry because they cannot return to recreation or sports right away, or cannot keep up with their schoolwork. A student may also feel isolated from their peers or social networks. You can offer support and encouragement by talking with the student about these issues. As the student's symptoms decrease, the extra help or support can be removed gradually. Please communicate any concerns to your school's concussion contact or school nurse. This presentation has covered the key points of our Return to Learn procedure and head injury concussion care. The following slide is the procedure in its entirety. Contact your concussion contact or school nurse if you have any questions about head injuries or concussions or the Pitt County Schools Return to Learn procedure. Again, this is the procedure in its entirety. Just a few reminders. Anytime a student is injured at school, including a head injury, an accident and injury form should be completed by the staff member who is supervising the student. These are to be turned in to your principal or designee. Head injury home treatment guides are available at school and should be sent home with any student who experiences a head injury. Parents should be notified of any injuries that occur at school. Athletes with a suspected concussion must follow the guidelines set forth by the athletic trainer program for return to play. Again, please contact your school counselor or school nurse with any questions.